I hope everyone's heard some key messages today, and I really wanted to sort of underline a few of them. First of all, real pride in the progress that collectively we've made over the last 6 months, emphatically in a partnership between different organisations at the centre, us, NHS Digital, NHS BSA, the NHS frontline and the social care frontline, and the tech sector. And I think between us, not everything's gone right. There are some legitimate gripes. There's some stuff we need to fix. There's some stuff we need to build on and do better. But we have made a degree of progress that would have been unimaginable 6 months ago. From the shift to remote consultations as the norm, the massive stepping up of remote working, the escalation of NHS login, the more than 7 million people who looked at watched videos on our Health at Home site, the better flow of data across the system, for example, in GP Connect and the additional information in the summary care records. I think we've made real progress, and I'll come on to how we build on that. But I think collectively it's been a sort of remarkable achievement. The second message is I hope you have clocked that we are trying very hard to listen to your concerns. So, for example, I know colleagues have been talking about the standard for the assessment of digital health products and the fact that we have taken on board the very clear messages that you gave us and responding to them with a better, lighter, more appropriate standard shows we are determined to try and get this right, and it's going to be an iterative process with you. And we are working hard to try and respond to the things that you've told us in these sessions that are your priorities. The creation of open standards, as Irina and Rod have been talking about, the creation of new and better procurement frameworks, the way we've done the AI lab and the AI awards that have just been announced. We've tried very hard to incorporate the feedback, the priorities, the things that you've told us are important. Now, I think the challenge is to build on the past 6 months, to work out where we need to sort of really, I don't like the phrase lock in, it's a bit too static, but lock in the improvements and build on them and focus on some of the gaps that the last 6 months have, I think, really highlighted. One of those gaps, which has been highlighted very clearly, is the gap between health and social care. And so we've reprioritized what we're doing so we can give top priority to a set of really sort of 3 objectives which we call joining up care, which are, I mean, 3 elements. First of all, it's making sure the entire country has shared care records built according to standards of interoperability that allow data to safely and appropriately flow between care providers in health and in care. There are some really good examples of where this is happening already, so we know it can be done. We know it's partly about tech, but more about people and systems, and we want to see everyone reaching a basic standard there so that we know that across the country patient data is flowing to where it's needed for to look after patients best. I think the second element is trying to raise levels of digitization and digital capability in the social care sector specifically, because it's quite hard for that data to flow. It's quite hard to tear down the barriers using digital technology if, as we know, a third of social care providers are fully digitized, a third are partly digitized, and a third are still using paper for everything. So, for example, we've piloted and now we're going to roll out much more widely, giving tablets to care homes. We've worked with the telecoms companies to improve connectivity, and we're looking at skills, innovation, at the systems that they use to try and really step up their capability. Third element is remote monitoring, which I know Tara's been talked about, but which has the most enormous potential to transform the way that we deliver care and the relationship between the citizen, social care providers and health providers, if we can get it right. And we're working hard with many of you and across the NHS to try and scale that at speed. And then I think that all collectively needs to be underpinned by some real clarity around how we operate. We've got a project which we call What Good Looks Like, which sets out, as the name suggests, standards around what different sorts of health and care providers need to do in digital transformation. We've got another project which is also similarly titled, which is called Who Pays for What? So we can finally give some clarity to what the different providers and systems can expect of the centre, but what they should be looking to fund themselves in digital. We can do much better, and we're going to do much better at providing clarity around information governance and how data can be shared with confidence through really simple guidance that's endorsed by all the key players. And I mean, fundamentally, and with this I'll shut up and pass over to Lord Bethell, our goal is to provide an innovation, a platform for innovation. We're never going to be able to, and we shouldn't aspire to, do the innovation centrally. We need to provide a platform so that you can, whether it's through the NHS app, allowing really straightforward ways for innovators to dock into it, whether it's through NHS login, whether it's through the way that the systems we set up to allow clinicians to access AI and proven systems there. I think the best, most effective thing we can do is continue to identify ways that we provide a platform for you, underpinned by standards, clarity on data, proper data flows and incentives that all push in the right direction. For this to work, you're going to need to continue to tell us what you need and where we're getting it wrong. Many of you have been extremely vocal at doing this, and I'm very grateful, because it allows us to keep iterating and keep getting it right. So thank you for engaging. And with that, I can pass over to Lord Bethell.